4 eyes, specky face.
Laser eye surgery has come to mean treating someone who wears glasses or contact lenses so that they don't need them anymore.
I have been short-sighted all my life as far as I can remember. I first wore glasses when I was 4. I had one point at school where the glass in my glasses was so thick that I was looking down and it actually fell out and broke through the plastic of my lenses and shattered on the floor, which was very hilarious for all my schoolmates.
I work for a bank and I'm a fund manager. So that involves a lot of desk work. I try to avoid the long-haul traveling a bit, do video conferences as well. I can't walk around without glasses. It started when I was 18, really, and I partly blame computer work for it, I think, and working in offices with air conditions and stuff. I think I put a lot of stress on my eyes.
When I started acting, my eyesight wasn't really a problem, but as I did more work with sort of very bright television and film lights, I found that my eyes were getting more and more tired at the end of the day with my contacts, which I think is part of getting older as well, but also quite specific to the job I do.
I was thinking about laser treatment when I heard about it, which must be like 5-6 years ago, so something like that.
When more and more clinics started opening up, I sort of picked up flyers and phoned them up and said, you know, hello, I'm interested, and they'd say, what's your prescription? And when I told them, they'd say, oh, well, we can do one of your eyes, but we couldn't do the other.
I was looking for high quality. And the more places popped up, I felt like I lost my touch with really finding what the best, person to go to would be. And I got, generally very good feedback on eye laser, but I also heard about cases where people were just, in a queue and then got onto the machine and got the laser treatment. And I just felt that, my eyes are so important to me. I didn't want to go just, to some chain that would treat my eyes and maybe, mess it up.
A friend of mine told me about London Vision Clinic, and I telephoned them and they said rather than straight off, we can't do one, they said, well, come in and have a look. And they sat me down and we had a lovely chat and they tested my eyes. And then blow me down, they actually said, yes, we can do something. And then probably a couple of days later came absolute terror. But the initial thing was just absolute astonishment when they said, yes, yeah, we can do it.
The range of correction in refractive surgery is now pretty much unlimited.
At my first appointment, they gave me a sheaf of questions that the London Vision Clinic recommend you ask any surgeon that you're considering using for this kind of operation. And a second sheaf of these questions with the answers given by Professor Reinstein. For example, safety records, safety of all the different procedures, just incredibly detailed, but very impressive.
For me, that's really one of the key points, really, to see what risks am I taking. I have only 2 eyes. I don't want to mess it up.
Well, the way that we manage fear is through confident, evidence-based information, not hearsay. So we feel that what we're doing is on solid ground. Knowledge dispels fear.
They're using the latest technology, and they're using German technology as well, so I could relate to that. I met Professor Reinstein, and he explained that he's actually cooperating with Zeiss, designing the machines, to his needs. I just felt I was in good hands when I met him, so I thought I want to go for the best.
Becoming a laser eye surgeon can be a very short path, or it can be an extremely long path, and I decided to take the long one. I went to medical school and became a doctor. I then specialized in eye surgery. Once I specialized in eye surgery, I then specialized in one part of the eye, which is called the cornea. That's the front window in front of the eye. And once I was a cornea specialist, I then specialized in altering the cornea to change the focusing. That's laser eye surgery. So if I count the number of years that I spent training, that would be a total of 18 years.
Okay, so how are you feeling?
Quite scared.
Okay, well, that would be normal. It would It would be abnormal if you weren't a little bit scared, yeah? But I'm not scared.
Okay.
All right.
The laser that we use for laser eye surgery is a highly specific piece of equipment. And because it's a very high energy laser, the light is absorbed in a very, very small area of the cornea. And it just so happens that you can change the shape of the cornea by thousandths of a millimeter, and you can effect a change in the focusing of an eye.
We've developed specific ways of changing the shape of the eye that achieve the correction, very high corrections, without compromising the night vision. And that's really research that we've done over the last 5 years. So it's not new, but because we've used it now on quite a few people, but it's very exciting because we couldn't have done this before.
In addition to correcting short-sighted and long-sighted and patients with astigmatism, a large proportion of our practice is helping people who had perfect vision to start with, and then age caught up with them, and they're starting to have to put a pair of reading glasses in every room in the house.
I need glasses for reading. I've worn them for over 15 years. So I don't have a problem seeing, given I have my reading glasses. I just have a problem losing my glasses, a lot. My work involves a lot of reading, a lot of computer work, and a lot of mobile phone use, texting. It would be so simple if I never needed to wear glasses again. That's my hope.
Okay, so bring yourself right up, a bit higher.
We've managed to develop a technique for correcting presbyopia or aging eyes. So we've got one eye that carries the vision from distance to mid, and the other eye that carries the vision from mid to near. And we've addressed two things. The first is that the difference between the eyes we've managed to decrease to such a small level that basically everybody can tolerate it. The second thing we've done is that we've improved on the optics of contact lenses. Because when you put a contact lens in your eye, you are changing the focus of the eye from one point to another point. And what we've done with these very sophisticated lasers is that we've learned how to reshape the cornea to change the focus of the eye from a point to a zone. And we call this technique laser blended vision.
Take your glasses off.
All right.
Okay. And just for a second, just look around the room. All right, so just...
So what's the time?
Yeah, exactly. Try and memorize that because it's the last time you're ever going to see like that.
Okay.
There are two main ways that we will use the same laser to do the same shape change. Ralph, for example, is having LASIK, which is by far the most popular procedure. About, say, 95% of all laser eye surgery is done that way. Lucy is having a surface procedure. It's known as PRK or LASIK or epi-LASIK. The main difference between them is the healing time. In LASIK, the healing time is a few hours, and in PRK, LASIK, this healing time is a few days.
We're setting the eye tracker here, which we're now going to test.
The laser that we use in laser eye surgery is very, very low power, and there is no way that this laser aimed at the eye can cause blindness. In the last 5 years, the safety of laser eye surgery, and that is with the best expertise, the best equipment, and the best aftercare, has at least matched, maybe even surpassed, the safety of contact lenses.
Okay. We've had perfect laser eye surgery.
Can you read this? Yes. Could you have read this 10 minutes ago without your glasses? It's coming up really clear now. Absolutely no chance. No chance that I could have. Brilliant. I can read every word.
Okay, you remember what it was like 10 minutes ago?
Yeah.
All right, check it out now. Open your eyes. Okay.
Wow. I can read this.
A little different.
Yeah.
You see some numbers up there?
Yeah, I can see the clock.
That's a big clock. What do you see over there?
See the signs, I can read them. I know what to do if there's a fire, it's great.
Well, it's been 10 days, more or less, since the operation, and I had no problems so far. During the operation, it was more like you touch your eye as if to remove a contact lens or something. So you feel a little bit on the eye, and ever so slightly a pressure, when the machines are fixated on the eye so it won't move. But there's no pain as such. I think the biggest fear I had was blinking, but obviously you can't blink because, it's been taken care of. But I didn't feel anything whatsoever. I talked to Dan during the operation, and it's not frightening at all. I went up from the operation and got home. I had a bit of a blurry vision. I had to take a painkiller and a sleeping pill, and through the night, I had no problems. The next morning, I woke up and I had super clear vision. It was amazing. I went back to the clinic for another checkup just to see, if everything is okay. And I must say they took really great care of me. I felt very comfortable just being surrounded by people watching over me. After 3 days, I started running again and going to the gym, and a week later, I'm in the pool again. It's amazing, yeah.
It's been 2 weeks since my operation, and the first few days were a bit fuzzy because I was on pain medication. But actually the pain wasn't bad. It was about 3 days, and then it was completely gone, and it was totally bearable. It was very similar to learning to wear my hard contact lenses, in fact. And then it was just incredible. I can see everything. It sounds like such a stupid thing to say, but I can. And I don't have to fiddle around with putting my lenses in. And I don't, that was a great moment, the sort of the glorious, here is my lens solution, here is the bin, goodbye. I mean, it was just, it's fantastic. It changes my confidence in the world enormously. On a purely maternal note, I can see her in focus first thing in the morning, and, I go in to pick her up, and I don't have to think about my glasses, and that's a complete joy.